My name is Dr. Ashok Gupta. I'm Director of Vascular and Endovascular Surgery in Saket City Hospital. It's the latest tertiary care service available in Delhi, based across South Delhi. I would like to discuss two topics that I commonly see with patient conditions. One is deep vein thrombosis, also known as DVT, and I'd like to mention about the correlation between DVT and long air travel, which is very common these days, and people who are seen all over the world suffering from this condition following this long air travel, maybe 1 or 2 days after they arrive to their destination also. DVT is, in layman terms, is a condition with a solidification of blood, which is known as thrombus, in the veins, usually of the legs. And it is predisposed by 3 conditions. Dehydration, if you sort of travel without having water or drink too much alcohol, say on the flight, or you dehydrate before you take the travel. Number 2 is if there's trauma to the vein, which can happen when you sit in a very cramped space for a long time. It can be trauma to the inner wall of the vein. And number 3 is when the blood becomes very, when it becomes more prone to clot, which can be due to some blood conditions or some genetic conditions. So these are basically the 3 conditions which, if they come together in a particular patient, they can predispose to thrombosis. Of course, there are minor other things, such as, not so minor, but other things such as obesity, smoking, ladies who take oral contraceptive pills, people who had recent surgery, people who had recent cardiac procedures. They are all prone to what is called DVT. So it's an avoidable condition, it's a preventable condition, particularly the one that happens in patients who have long distance travel. So avoid dehydration day or 2 before travel, which means no alcohol, very little alcohol, lots of water. Number 2, always even when we are in the economy class or of the aircraft, always take time to walk in the aisles every 2 hours. Walk up and down. Walking is good exercise, it keeps the circulation going. Again, avoid excessive amount of alcohol while on flight. When you arrive at the destination, make sure that you have plenty of water, take some rest, you keep your legs elevated for the first night over a pillow or 2, and have regular exercise. Again, avoid alcohol. So this is a preventable condition. What do you do, or how do you suspect that you've got it? Now, this is a very important question, and you should know it, because some of the patients who come to us, they come with complications of this condition, and that those can be fatal. So if you arrive at a destination after a long air travel or longish air travel, and you have a very swollen leg, you have pain in your calf, which you did not have prior, or you've had any of the risk conditions as I mentioned in the previous part of the talk, do be careful that you could be having, or be aware that it could be deep vein thrombosis. You should see a doctor there, a medical facility there. This condition can be diagnosed by a very simple ultrasound-based test, which is pain-free, very patient-friendly, relatively quick, and no needle is involved, and the diagnosis can be made. The treatment is in the form of blood thinners and certain other equipment which specialists can advise, but the most important thing is to pick up the diagnosis in time. The condition is not lethal, it is chronic, it becomes very difficult to treat as it establishes in long term. But the problem is that very small percentage of patients get very lethal complications, and those can be life-threatening. So have safe travel, keep yourself well hydrated, keep yourself well informed, and therefore avoid deep vein thrombosis, particularly related to long distance travel. Second condition that I would like to highlight is what is known as diabetic foot conditions. Everybody seems to be talking about diabetes mellitus and its problems and complications, which are there, and I think they should be discussed. The more discussion that we have on this topic is better for the patients. But diabetic foot is easily ignored even by the patient and the specialist. Training facilities are few and far in between in our country. All I can say in pure layman terms, if a diabetic patient does not look after his or her feet, they will not have the feet to walk on, because they will lose their feet. So therefore, the chronic diabetics who have been on insulin for a long time, or who are early onset age diabetics who have been in diabetic condition for 20 years or so must look after their feet more than they look after their face. By which I mean somebody should have a cleaner look at their feet, look in between the toes, make sure they don't get fungal infections. Nail cutting should be done by a professional person. Should not apply very hot water bottles or cold water bottles because their sensations are not normal and they can burn themselves easily. Any small cut or abrasion or darkened patch on the foot should be taken very seriously. Corns and calluses should be taken care of very carefully. Specialized services are available. Glad to inform in this line, Saket City Hospital will be launching a comprehensive diabetes program which will include a footwear clinic, particularly for the diabetics, where we will be looking after the entire 360, starting from education to diagnostics to treatment and prevention of complications, and if complications are there, we will be dealing with them also. So diabetic foot is an entity. It causes causes a fair amount of morbidity in diabetic patients and causes loss of quality of life. Occasionally, or very rarely, it can cause loss of life of the patient also, because sometimes septicemia can spread from them. And it is again preventable, and for the patients to take as much care of their feet as possible.